Hi, my name is Dr. Raja Adnan Ahmed and I am a consultant psychiatrist working in UK. And I'm making a series of short videos where I will discuss the commonly asked questions which comes up in the interview at different levels. And this is for the benefit of IMGs who are coming to UK, and it might be their first time to encounter a panel in UK, and some of the IMGs may struggle with these commonly asked questions. So we will discuss what are the themes of these questions and what are the panel trying to ask you through these questions. So let us start with the first question. This is a very commonly asked question which you may see in a junior level interview all the way up to consultant. So the question is that how will you deal with a colleague who is turning up at work intoxicated, with alcohol, or drunk? So there are different versions of these questions. It may be that you are on call and your colleague turned up drunk, or you are working in a theater and you realize that your consultant is turning up drunk, or you are working on a ward and one of your colleagues is coming there regularly smelling of alcohol. The other version of these questions, you might find some other problem with your colleague. It might be that your colleague is not turning up on time, or they are not doing their job properly, or they are not answering their bleep. So it is important for us to understand the different version of this question, but they are all trying to ask the same thing. So how will you answer this question, and what is this about? So although this involves yourself and a colleague, but remember this question is about patient safety. There are two aspects of this question. Number one is patient safety, which is the top priority, and number two would be helping a colleague who may be struggling. So we will tackle both of them. Remember, we exist as doctor, we are paid as doctor, and we work as doctor just because of our patients, and patient safety is number one priority. If you go to the Good Medical Practice and read the article 25, it's all about understanding the concept of patient safety and reporting and escalating the concerns whenever there is an issue with patient safety. So let me give an example of how this was asked from me when I was a junior doctor. So I was asked by the panel that you are on call and you just finished your 12-hour shift, but the night SHO turned up and he's smelling of alcohol. What would you do? I said, this is a patient safety concern. I won't be happy to hand over my bleep or hand over to a colleague who I believe will not be able to do the job properly and keep my patient safe. The panel then pushed me from different angles. They said, you have done a 12-hour shift, your partner or your wife is waiting at home and you're already very tired, what would you do? I said, no, I will not leave the ground. I have to escalate this. I will escalate it to my senior and I'll inform them that there is a issue here. The panel then pushed me further, saying that your consultant said that he'll come down, but it'll take him 3 to 4 hours. And you are already very tired, and what about the European time directive? Would you go home at that point? I said, no, I will have to make sure that my patients are safe. Therefore, if I have to stay 3-4 hours extra, I will stay for 3-4 hours extra, but I will not hand over the job to a colleague who I believe is not in a position to look after my patients. So remember, when this question is asked from you in different versions, your first priority will always be patient safety. And if there are immediate patient safety concern, you will escalate it to your senior and you will escalate it to further if required. For example, if the scenario is that it is actually a consultant who is coming drunk or intoxicated, then there are others, there are senior managers, clinical directors, other people who are on call as well. You have to escalate to them, because then still you will not sit back and just take it as it is. In this question, they are specifically trying to find out that if you can take initiative and a stand when your patients are at risk. It may involve your senior, it may involve your colleague, it may involve your relationship getting worse with your colleagues or your senior, but you are taking initiative and you are showing that you are concerned about your patients, and that is your topmost priority, and you will not let it get compromised in any shape or form. Also mentioned that this question may be about helping a colleague who is struggling. So let's look at another version of this question. When they ask you, the colleague is turning up late all the time in work, how will you deal with that? So, you have to first mention the patient safety. If there are any patient safety concern, I'll have to escalate and have to make sure the patients are safe and not getting compromised because of somebody coming late. But if there are no immediate patient safety concern, you need to step back and gather some more information. Maybe you will speak to the colleague. Maybe you will try and understand what is going on. Somebody maybe they're coming late because there are some transport issues. Maybe they are coming late because there are some childcare issues and there are other stresses in their life. Some people may drink alcohol because they are going through a difficult time in their life. So maybe this is a time when you can actually offer them some help, especially if you are in a middle grade or senior position. GMC Good Medical Practice article number 43 specifically talk about helping a colleague who is struggling. But again, they also mention that please do not let patient safety get compromised because of that. I hope this is useful. Remember, in a situation like that, patient safety is your topmost priority. Gathering more information, escalating it to your senior, and taking an initiative very important. The interview panel is looking for a safe doctor. Remember, there is no one way to answer this question, and I am giving you an outline which might help you understand the concepts behind these questions. This is not the only answer. You can make up your own answer, or you can understand your own concepts around this question. If you need more information how to tackle this question, please read Good Medical Practice and the article 25 and 43, which will give you good clues about how to answer this one. But remember, in any interview, you need to be yourself and you need to show the panel that you are actually passionate and genuine about the things you're talking about. Because the people who are interviewing you, they are very senior clinicians and they can tell very easily if somebody means it or somebody is trying to act. Thank you very much. I hope this was a useful video, and please do not hesitate to give me some comments, or if there are any other questions which you struggle with during interview, please let me know, and I'll try and do my best to give you an outline of what the panel may be expecting and how to tackle those difficult questions. Thank you very much.